Good evening, everyone, and thank you so much for joining us tonight. We're very excited to have you here. Before we get started, I'd like to read this brief disclaimer that you see on your screen. The PharmAssist virtual learning experience brought to you by Mandel's Clinical Pharmacy is intended only as an educational program for patients. Any clinic-specific information shared by the nurses is the opinion of the nurse and is not intended to replace the recommendations or requests of your healthcare professionals. All medications will be dispensed by Mandel's Clinical Pharmacy according to the prescription as written by the provider. And now that we have that out of the way, thank you again for joining us once again, everybody. We are so happy to have you here tonight. My name is Craig Orapello, and I will be your virtual host tonight. So you are joining us to the PharmAssist virtual learning experience and educational program that is created by Mandel's Clinical Pharmacy to bring you together with outstanding healthcare professionals right from the comfort of your very own home. The PharmAssist program takes place every Monday night at 7 p.m. Eastern Standard Time. Tonight, we'll be providing a live educational medication instructional program on 3 fertility products, including an interactive Q&A throughout the course of the program. Now, how does the interactive part work? Well, that's where you come in. So you can join us via Zoom or Facebook Live, which is where you probably already are. And we invite you to be a part of the discussion by sharing your questions in either format, either in the chat or in the Q&A section on the Zoom app. So as always, we are joined by various amazing HCPs each week from across the nation to provide you with a real world experience, just as if you were sitting across the table from them in the clinic tonight. And today we are joined by Kaitlyn Endicott. So I want to thank you all again for your time and interest this evening. Thank you, Kaitlyn. And now I'm going to turn it over to you, Kaitlyn. Take it away.
Great, thanks, Craig. And thank you all for joining us tonight. Again, my name is Kaitlyn. I'm an IVF nurse in the Northern Virginia area. I hope that tonight's instructional videos and the live chat and discussion really help you to gain and understand confidence with these medications. Given the fact, of course, that they're injections, it is daunting. So the purpose of these videos is to help you be more comfortable and have a little bit of confidence before that first injection. Tonight, we will be discussing 3 different medications. So we'll start off with the Gonoloft Eject pen, and then we will do HCG, and then we will finish the evening with Avodro. After each video, we'll have time for Q&A. So type in your questions. We can tackle it as we go. If later in the program you think of things that maybe were in reference to the first video or an earlier subject, feel free to just throw it in there and we can handle that, no problem. Do please keep in mind, though, with your questions, I can answer general questions about the products, but I cannot answer any specific questions as to maybe why you're on a certain dose or any given medication. I can't tackle anything specific to your treatment plan. That's something that I'm going to have to defer to your provider. Again, I want you to be comfortable with these videos, so feel free to ask any and all questions that come to mind. These will be pre-recorded as well. So this whole live session will be available to you later. So if you are taking notes and you missed something, you can always go back and catch it later for future reference. So with all of that, I think we are ready for our first medication, which is the Gonoloft Eject pen. We're ready when you are, Craig. In order to inject the Gonoloft Eject pen, you need a couple of supplies. First supply is, of course, your pen. Second supply is your needle cap. Your box should come with a bunch of these little guys in there. Third thing you'll need is your alcohol swab to prep the skin site. The first thing I have patients do is, of course, take off the cap to your Gonoloft pen. You'll see there is a chamber. This is where the medication is held inside of the pen. There are different units of pens, so depending on the size unit that your provider ordered, there will be different amounts in the pens. So I always confirm that there's the correct amount in the pen. Then take the needle cap. This paper will peel off like this, and you'll see the needle inside. Be careful not to prick your finger there. And then the cap just twists on to the top of the pen. At this point, I have patients dial up their dose. So you'll see that there is a window there. You can see 0 in there now. Depending on what your dose is, that is the dose you will dial up to. So for the sake of the video, we'll dial up to 150. So you'll dial it back until you see 150 units in the window. Now, if you go too far, that's okay. Go back and forth. It's not going to hurt anything here. So go until you see 150. So at this point, I recommend prepping the skin site. Now this is a subcutaneous injection, which means it's just going to go into the fatty tissue. There's different sites that you can use. Your provider might have a preference. In general, typically, I recommend the abdomen, so anywhere that you can pinch an inch of skin and the belly fat is fair game, as well as the thigh tissue as well. For the sake of the video, this is going to be my skin for today. So at this point, you'll take your alcohol swab. Go ahead and clean off the site. Let it dry. Let it sit for 15, 30 seconds until it's completely dry. That helps take away any discomfort when injecting with the needle. Then you will take this big cap off, and you'll see a colored sheath here left over. Now this is your last line of defense before the needle, so make sure that everything's ready. Once you have confirmed that you're ready to inject, you'll take this off here and you'll see the needle. At that point, you'll pinch an inch of your skin that you've already prepped. And then I recommend, I tell my patients to have the window with the numbers facing up toward you so you can actually see it when you're injecting. And then you'll go in fast, 90 degrees like a dart. Yes. Wiggle your hand up and you'll push that plunger. Push it hard, and as you're pushing the plunger, you'll actually see the window go down to 0. That's how you know you got your full dose. At that point, you can take it out. And then I recommend recapping with the big cap so that you don't stick yourself. That just pushes on there. And then it turns off the opposite way. This part goes into your sharps container. Your Gonoloft pen, you can put the lid back on. They are multi-use, so be sure to save it for your next dose. You don't want to toss it out until the pen's completely empty. Okay, so that was the Gonoloft Eject pen. That one is a good one to start out with because it's relatively easy in terms of it doesn't need mixed. It's all pre-filled and kind of ready to go for you. So really the big thing is just, mustering up the courage to physically do that injection. One thing too that I would want to elaborate on from the video is when you're doing the injection, like I said, you have to push your plunger down hard. And the reason I say that is I have had some patients that push the plunger and there's a little bit of give in this gray area. You can kind of see it there. When you're injecting, you actually want to push that further so that the red is what goes down. Okay, so it might feel like you're getting it, getting it to go in with just the gray, but you actually want to push hard so that the red goes down. And that's why I gave the tip too, to watch that window so that the numbers are all the way to 0. That's the way to triple check yourself, but you kind of have to push kind of hard on the pen. So just a small tip there. Do we have any questions quite yet, Craig?
Yeah, we actually do. A couple are coming in. So first thing, I just want to remind everybody that you can put your questions right into either the chat on Facebook, or you can put them into the chat and the Q&A segment on Zoom. So either one of those, and we'll make sure we get to everything, such as this one, which is actually probably one of the most asked questions we get about pretty much any one of our products. And you've answered this before, so you probably have this ready to go and in your Rolodex of answers from the show. So how does FSH work in general? What part does it play during my cycle treatment?
Yes, very popular question. So of course we want to not only know how to do these medications, but we want to know why we're doing them, right? So Gonoloft is actually FSH, which stands for follicle stimulating hormone. So in a natural menstrual cycle, your pituitary releases this hormone, and it quite literally does that. It stimulates the growth of a follicle. So within your ovaries, you have follicles. Within the follicles, you have eggs. So in fertility fertility, we're watching the growth of those follicles because we can't see those itty bitty eggs on ultrasound, but the follicle growth gives us an indication that those eggs are actually growing. So that's what this medication is doing. It is giving more than we would naturally give, of course, in a menstrual cycle of that hormone so that we can stimulate the growth of hopefully multiple follicles so that we're yielding the most mature eggs that we're going to get in any given cycle. Of course, the goal is always to have more than one because that's what a normal menstrual cycle will give you. So that's the goal, is to kind of override what our brain tells us to do and retrieve as many eggs as possible. So it's creating the ability for those follicles to develop and the eggs to grow within them. Very good question.
Awesome. Perfect. Thank you so much, Kaitlyn. And this next question that came in is, it's another one that comes up pretty common for almost all the different products. It's just something that people like to know. On one end, we just obviously covered what is this product doing? And on the other end is like, oh God, what if I made a mistake, right? And so this question is, if I missed my shot with the Gonoloft pen, how long after can I give it before I just have to skip it and prepare for my next shot? So I guess like when's that kind of point of no return of when it's just time to say, we missed it, we got to move on?
Yeah. So this is one that I would definitely confirm with your clinic, how they want you to move forward if you realize you missed an injection. So a lot of times it's going to depend on when you noticed you missed it. So if, for example, say you take your Gonal-F every single morning and you forgot this morning and it's 7:15 and you're like, oh no, totally forgot. Some clinics may just want you to go ahead and take your dose then, tomorrow, move on like you normally would, take your Gonal-F in the morning, same dose, on with your day. Say you didn't notice until tomorrow and you're about to do tomorrow morning's dose and you say, oh no, I don't think I did it yesterday. Definitely check in with your clinic, see if they want you to make up for that in some sort of way, or maybe they'll just note it in your cycle. So, if they notice, small discrepancies here and there, they may say, oh, it may be just because we missed that dose. So definitely something that I would, refer to your clinic on for guidance. But most times the Gonal-F is going to be one that does have a little bit of wiggle room. I usually tell my patients try to take it within an hour of the previous day's dose. If you don't do it right on the dot, definitely not going to like make or break your cycle. But just to avoid this happening, I also tell my patients set alarms, use your iPhone or whatever device you use that you can just have it pop up and tell you, hey, reminder, time to do it. That way it's one less thing you have to think about. It does the hard work for you and reminds you to do it. So that's one tip I always tell my patients, and they seem to like the alarm system on their phone. So great question.
Perfect. Yeah, I think nowadays in 2021, probably each of us have at least 5 to 7 different items in our house that can remind us when to take a shot, not including maybe a significant other or somebody like that, but electronically, we have a lot of options. So that's a great question. And also a really good question as we talk about Gonoloft, as we get into the products later on, where, the wiggle room becomes a different thing. So it's a good thing to know the products where, the timeline when your nurse gives you a time of when to give a shot, it's always good to make sure you try to stick to that whenever possible, but to also know, what to do in case of a mistake, because it's going to happen or it may happen, and you're not going to be the first person. So good to get that out of the way here during PharmAssist so it doesn't happen in the real world. So great. Thank you again on that one. Okay, so this one is about the actual injection itself. And so the question comes in, it says, I tend to get injection site pain in my abdomen earlier than in my arms or other sites. Is it okay to skip those and just do arms, or will that cause an issue with those injection sites?
Yes. So, if you're noticing that certain sites are more tender than others, I would go ahead and either, for this instance, the abdominal area is a little more tender, it sounds like. Go ahead and start off with the arms. You may find that you have that tenderness after, being on this for days at a time. It can definitely cause that. but you could always rotate sites completely as well. So you could start off, I always say to do the back of the arm where you can pinch. So you could do this arm one day, the next day this one, then maybe one side of the abdomen, the other side the other day. You can also use the tops of the thighs as well, kind of that outer thigh. So really anywhere that you can pinch an inch is always what I say. Anywhere you can pinch an inch of skin is fair game, but those are the 3 sites I recommend doing, just kind of logistically, and they are kind of formal sites for subcutaneous injections. So maybe not just rotating sides at whatever site you choose to do, but you could totally rotate sites every single day. That way, when you get back to the very first site, you're 3 to 4 days, after that first one. It might help with the tenderness you're experiencing. That's my best advice for that, because after you're on these injections for a week, 10 days, it definitely gets tender. So that's going to be your best bet to rotate around.
Great. Thank you very much. I think sometimes people tend to think that the injection site is like like when you were talking about in the, when you did the presentation, you talked about fast and sharp like a dart. People tend to think sometimes that it means it's like a bullseye where you're giving the exact same spot of like your abdomen or your arm every single time. And you have the luxury of rotating within injection sites so that you can try to stay away from areas that feel a little bit tender and kind of move around a little bit. So there's a lot of spots
Definitely.
on the body, so that's good for people
And
to know.
two, on the abdomen area, I tell my patients, if you think of it kind of like a clock and you work your way around, that's a good way to do it. That gives you about 12 different sites when it's all said and done, roughly. But if you're just sick of doing the belly, you can do the same thing elsewhere. Just try to keep it uniform so you remember where you were at.
Perfect. Great. Thank you very much. And now, speaking of injection sites, obviously one of the things that comes up quite a bit on here between, with a lot of these questions are some of the things about the way, how the product they're going to be received by it, and what are some of those side effects that they might feel going through the process. And this question comes in a little bit more general, just about side effects in general. Just says, what common side effects can I expect with FSH, and how can I treat them after the fact, or hopefully prevent them beforehand?
Yes, this is a question I get a lot. And I will say, generally speaking, with the FSH medications, they are pretty well tolerated. I will have patients that have minor side effects here and there, but overall, most times my patients are like, oh, okay, I don't feel as bad as I thought I was going to. But common ones that I do hear about more often than others is probably bloating and some fatigue. And when you think about what this medication is doing, like I said earlier, it's stimulating the growth of your follicles, and within those follicles, eggs. As eggs and follicles grow, they're actually releasing estrogen. So in an IVF cycle, your estrogen is much, much higher than it is in a typical menstrual cycle, what you're seeing. So those are more so the effects that you're feeling from, is that high estrogen level. So like I said, the fatigue and bloating, a lot of times this is more so towards the back half of your IVF cycle. Usually in that first half, the estrogen levels haven't gotten up so high yet to be feeling that. Also, I get the complaint of headaches here and there. That's a one I hear, but usually again in the back half of this cycle. And just kind of along with the bloating, just a little bit of tenderness sometimes. If you think about this, your ovaries are growing multiple follicles, so they're actually physically getting bigger in size. So some tenderness can be normal as well through this cycle. But usually after the egg retrieval procedure is done, your hormones kind of plummet down. After that, most patients are feeling most of those side effects and back to their normal self by the day after or a couple days after. So it's usually not something that sticks around for very long after that egg retrieval is done. And then another thing, just to kind of feed off of this a little bit. So like I said, your ovaries are increasing in size, so they're physically getting bigger. It's super, super important while you're on these IVF injections to stay away from any like high impact exercising. So no jumping, twisting, abdominal exercises, that sort of thing. You want to keep it low impact. Walking's fine. Easy stationary biking. No crazy cycle classes where you're bopping up and down. And the reason is that your ovary is larger than normal, and it's at risk for what we call torsion or turning on itself, which can risk the health of your ovaries. So you definitely want to stay away from that as well. But a lot of times with, if patients are kind of feeling bloated and fatigued, working out doesn't sound like the best thing, but definitely an important thing to keep in mind to stay away from that, while you're on these medications.
Something I wish I was told more often is to stay away from exercising.
Yeah.
So anybody who can take that for a little bit, hey, take it when you can get it.
Exactly.
That's great. Thank you so much, Kaitlyn. We appreciate it. And these are the types of things sometimes, these questions you get a little bit more into the nitty gritty on some of the things that people want to know. And our goal, again, like we mentioned before, is so that get all that stuff out of the way now. So later on, when you give the shot, you can just focus on giving yourself the injection and then just letting, the process go through and not worrying about all the little potential, questions, fears, nerves, things like that. So thanks so much for all the great answers so far. And as of right now, it looks like we are all caught up. But as I know Kaitlyn mentioned before, like we want to give everyone a chance to get your question in. You may have just heard that question and thought of another question you want to, ask on top of that. So we'll give everyone another, let's say 30 seconds or so. I'll kick it back over to you while people maybe get a chance to type that last one in before we move on to the next product.
Perfect. Another question I do get a lot about the Gonoloft is kind of storage and when does it expire and that sort of thing. So I always like to cover that in these live sessions. So my biggest tip of advice is when you get your package in the mail, your Gonoloft is going to be in like a cooler bag to keep it nice and cold. Take it out of there, put it right in the refrigerator. That's where you want to keep it until you're ready to use it. As long as it's refrigerated and stored at that nice cool temperature and unopened, then you know it is good until the expiration date. Now, if say you forgot to put it in the refrigerator, it reached room temperature, it's unopened, that's okay, but you have 3 months to use it from that time. And then the other question I get about this is if you have a pen that you've used part of and you have a little bit left and say you're doing another cycle, is this still good? So once you have punctured or used the pen for the very first time, you have 28 days from that date to use it until the medication expires in there. So I always tell my patients once they open up their new pens to write on there with a Sharpie the date that either the date they wrote it or if they want to count forward the date it expires. That way you don't have to think back and guess as to when you opened it and when it may expire. Then you know what you're working with in terms of the dates. So that's another hot topic that usually comes up as well.
Perfect. So it looks like we are all caught up right now. So we're ready to move on to the next product. And as again, if you think of something after the fact, anybody at home, you think of a Gonoloft question after we move on, you can always bring it up after any of the products. We'll have an open little session at the end as well. So feel free to whenever your questions come to you, you can jump back on. But in the meantime, we can jump on to the next product, Kaitlyn.
Great. So next up we have HCG. This one is most often used as a trigger injection, meaning it triggers ovulation. There's many different brands, different doses, different ways to do it. So I believe in my video I showed the intramuscular way. So we are ready when you are, Craig. Now I'm going to show you how to prepare and inject an HCG trigger shot. So first I recommend gathering all of your supplies. You will need an alcohol prep pad, your medication. It should come in powder form. You can see a little bit of the powder there. Your bottle of diluent, so saline or sterile water. And then you will need your injection needle. So this will be a 3 ml syringe with a 1.5 inch needle attached to it. So to start, I recommend taking off all of your caps. So there will be a cap on your powder that'll just snap off, and same thing with your diluent. Next, you can open up your syringe. So it'll peel open like a banana peel. this comes out. Then I would go ahead and draw back the amount of air that you're planning to pull up of diluent. So this can vary from practice to practice. At my practice that I work at, we recommend mixing with 1.5 mLs of the diluent. So I'm going to pull mine back to 1.5. Take off your cap. Then you're going to insert your needle into your vial, push all of the air in, flip it over, and you'll kind of feel the plunger naturally pull back on its own. Make sure that your needle, and I'll turn it here, is in the actual liquid and not pressed up like this. Otherwise, you're only going to draw back air. So make sure you pull it down some and pull back until you have roughly 1.5 or whatever your provider recommends. Now you can see there I have a little bit of air in the top of my syringe here. You can actually push everything back up and start over. It won't hurt anything. So I'm going to pull back here. I have roughly 1.5. So now I can take this out. Now I'm ready to reconstitute my powder. So you have your powder vial. You see the rubber stopper here. The needle just goes right into there. Push saline in. And then give it a good little swirl. Helps things dissolve, but typically the powder dissolves just about instantly. Then you can flip it over. Again, make sure you pull the needle down so it's within your liquid. You can pull everything back. Now you're going to have roughly the amount of fluid that you put in. Some of it does get displaced when it is dissolving the powder, and that's okay. The most important part here is to make sure you get all of the liquid out of that vial. Once you have that, you now have your dose. Can take the needle out of the syringe, and now you're ready to prepare the skin site. So this is an intramuscular injection, so different from the subcutaneous injections you've likely done up to this point in your cycle. I usually recommend doing the upper outer quadrant of the buttock, so it's almost like the hip area in order to do this injection. So at this time, you can take your prep pad, clean off the skin site, let it dry, and then you actually want to pull the skin kind of taut when you do this to be sure that the medication gets to the muscle. When you're ready to inject, you go in fast, 90 degrees like a dart, and then push your plunger in. Take it out here, and you're all done. Okay, so that was the HCG trigger shot. Like I said, this one, I showed you how to do it intramuscularly. It'll be up to your clinic if they want you to do it that way, or maybe they want you to do it subcutaneously, which is the same options for sites as your Gonoloft. So abdomen, arm, outer thigh. If that's the case, then you can still use this video for mixing, how to mix it. Typically, you'll still get that big long needle to at least mix. And then if it is a subcutaneous injection, make sure you're not putting that big long needle into belly fat or arm fat. You want to actually take that needle off, put on your shorter little like 1/2-inch needle, and you'll be able to do the subcutaneously. So with that being said, do we have any questions coming in yet?
All right, let's see here. So we do have a couple questions coming in. So the first one says, how do you, again, I'm assuming when they say you, they're specifically saying for you on your end as the nurse, like how do you as the nurse calculate the exact time window for when somebody's going to be giving their HCG injection?
Mm-hmm. So it will be dependent on your clinic. What they prefer to use is their time window. But what in general, what we're looking at is your retrieval time. We're counting backwards to a certain amount of hours that you would have done your trigger injection. So typically it's around 35 to 36 hours. There is some wiggle room there from clinic to clinic. It is extremely important though that you listen to your clinic at exactly what time they want you to do this injection. what it's doing is it's actually triggering ovulation. So it's timed out so specifically that while the egg is actually growing in the follicle in your cycle, it sticks. If this is our follicle, it actually sticks to the wall of the follicle as it's growing. What the trigger shot does is it gives it one final boost of maturation. So it gives it a little bit of maturity. And then it also causes it to release from the follicle wall. So the egg is free floating in that circle in your follicle. We're timing up retrieval so that we go in to aspirate the egg out of the follicle as it's free floating in here. So we don't want to get in there when it's still stuck to the side. We won't get the egg out. We also don't want to wait too long that the egg is ovulated. So it's left the follicle and then we go in to get it and there's nothing there. So that is the purpose of the strict timing for this one, where I said that the Gonoloft had some wiggle room. This is one that you really, really, really want to pay attention. Make sure you're doing it right on the dot. Super, super time specific for success of the cycle. That's a very, very good question. Very important.
Perfect. All right. And now this one, okay, so this one comes in just about some of the different brand names regarding HCG that are out there. And so it says, my sister was prescribed a different brand name of HCG during her cycle than I was. Is there anything different between the HCGs that I should be aware of? Are there different side effects or mechanisms of action or anything like that?
Yes, great question. This is one I get a lot from my patients as well, just because there are so many options. Now, most of the HCG brands are going to be same med, different names. So kind of like Coke and Pepsi, or 7 Up and Sprite, that sort of thing. Although some people will argue that Coke and Pepsi are very, very different. But for the sake of this, same med, different brands. So they all work the same. The goal is to cause ovulation. Of course, we're catching the eggs before that happens. I would not worry about brand specific for this one, generally speaking. There's really going to be no difference in your side effects, mechanism of action. However, maybe your clinic has a strong preference, so I would triple check with them. But usually I recommend going with whatever is, going to be most cost effective at the end of the day, because across the board, to me, they're all the same. So as long as your clinic has the same, view for that, there's a few different brands, there's generic. So I would compare pricing and go from there.
Yeah, and it's perfect. One of the things that Mandel's will do is help you out with the financial aspect of your medication. So when it does come down to that time frame where you're looking to see pricing and you want to see what's available and what's covered, and what your out of pocket is going to be, sometimes there's going to be, as Kaitlyn said, sometimes there's going to be circumstances where the medication stands alone, and that is the one that you need to take, right? But there will be certain circumstances, like in this case, where Mandel's will certainly be a huge advocate for you as the patient to be able to determine what is available and what costs, and also work with your clinic to make sure that there are options on the table. And if there's not a reason why they prescribe something, that we can assist with, getting you over to the one that is most cost effective. So thank you, Kaitlyn, for bringing that up. That was
Yeah.
perfect. All right. So let's see. Next question coming in says, so this one, we talked about the missing of the Gonoloft shot and the time frame there. So I'm guessing this probably came up because of that question, because we have a question that says, what options do I have if I miss my window with HCG? How tight is that actual window anyway?
Yes. So a few things here. So if you miss your window, number one thing, contact your clinic, let them know immediately. If they have an on-call, if they're closed, you want to call that on-call and utilize that feature. They need to be the ones that determine how you move forward. Depending on the window of time, they may say, nope, you're fine, we're good to go. They may say, hey, we need to delay the egg retrieval procedure, but we can still make it work. Come at this time instead of this time, or whatever that may be. Now, I believe that, don't completely quote me on this one, but I believe the timing in terms of the window of ovulation after HCG is roughly 38 hours or so, maybe a little bit more, from the actual injection, which is, why most times you'll probably see like a 35 to 36 hour window. It's giving a pretty good buffer room. But like I said earlier, right, the egg is growing attached to the follicle wall. So not only are we timing to retrieve before ovulation happens and it leaves, but we're also wanting it to be free floating in the follicle. So we're on two ends of the spectrum there with the window. So super, super, super important that you do take this as you're instructed at specific time. But in the off chance that you don't, give your clinic a call because they may need to move around times or whatever that may be. So definitely something that you want to triple check with them. But I think technically there's a decent window, but like I said, you're working from both ends. You don't want the follicle to be stuck, or the egg to be stuck in the follicle, but you also want the egg to be in the follicle when you retrieve. So super duper important to set your timer for this one to remind you. Very, very good question. We don't want to be in this situation, but it does happen. So definitely call your clinic.
Perfect. Yeah, and that's great information just on a lot of some of these questions, that there's a lot that your clinic can definitely help you with. And I know we talked about it before, but a lot of times we feel like we're in this all by ourselves, but any situation that you're going through, your nurse, your clinic have seen it before. You're not going to be the first one. So when in doubt, ask. And that's always a really, really good way to handle all of these types of questions. Is, hopefully you can get it out of the way here, right? And so you don't have to worry about it then. You ask the questions now so you can remind yourself later on to not miss that window. But when you do find yourself in certain circumstances, and some people will, it's how it is. Make sure that that you can reach out and ask, and they'll be willing to help you. So that's good to know. So thank you very much. And with that being said, seems like we are caught up with questions for right now. So we'll give another 30 seconds again for people to get that last question in if they have any, and I will throw it back over to you before we get ready to move on to the third and final product for the evening.
Great. So like I said with this one, I showed you how to do it intramuscularly. Confirm with your clinic if that's how they want you to do it, or if they would prefer subcutaneous, or how they like to do their HCG triggers. But a lot of times this is the first time in a cycle, or in treatment, that patients are doing an intramuscular injection. Most of the previous medications in an IVF cycle are going to be subcutaneous. So this one can be a little bit daunting for that reason. There's a few things you can do to kind of help with it. The first thing is there are some numbing options. There's a Sonera patch you can use, and it's a patch that you put on for 20 to 30 minutes before you do the injection. You just put it at the site, and then you take it off, and it kind of helps to numb the area. Another thing that I offer my patients is you're likely already, going into your clinic that morning for monitoring. So while they're there, I will draw with a Sharpie a little target of where it needs to go. So if you don't mind having a Sharpie on you, I'm sure that, your nurse would be willing to do that. But a lot of times with those intramuscular injections, not only, half the battle, of course, is doing the injection, but the other half is, am I doing this in the right spot? It's a little awkward, that sort of thing. So just a few little kind of hints there that can take one step out of the equation for you when you're doing it, and you only have to focus on getting the timing right and physically putting the needle in. So hopefully that will be helpful.
Sounds good. Well, thank you very much, Kaitlyn. With that being said, it looks like we are all caught up, so there were no additional questions. So once again, if you think of anything after the fact, after the third product, you are more than welcome to bring any questions up. But we are ready to move on to the third and final product for the evening.
Great. So lastly tonight, we have Avodro, which is actually another HCG option. So we're kind of on an HCG kick today. This one is going to be subcutaneous, so you'll get to see that type of injection as well, very similar to the Gonoloft. So we are ready when you are. Now we're going to review how to do an Avodro subcutaneous trigger shot. Now the shot will come in a box that looks like this. It's all pre-filled, ready to go for you. No mixing, the needle's ready. So this is generally just how to do a subcutaneous shot. So you'll need your supplies. You'll need your injection. So you can see it here. You also need your alcohol prep pad. and that's it. So since the shot is ready to go for you, really what you need to do is select your site for injection. Now, subcutaneous injections can be done in multiple places. I would confirm with your healthcare provider where they want you to inject. Generally, I recommend either the abdomen or the thigh tissue. Really anywhere that you can pinch an inch of skin is fair game. I think most of my patients end up doing the abdomen, but it's up to you. So once you have chosen your site, you will open your alcohol prep pad, clean the area, let the alcohol dry, and you will take your injection, take the cap off, and you will see the needle there. Now, if there's a little bit of air in there, you can always press it up to get rid of it. Otherwise, it's pretty much pre-filled for you. Then you will pinch an inch of skin, so that area that you prepped, pinch that inch in fast, 90 degrees like a dart. Press the plunger. Hold it for a few seconds, then remove. At this point, this can go straight into your sharps container. No need to recap it to risk sticking yourself. And you've completed your Avodro trigger injection. Okay, so that was the Avodro. Again, another kind of HCG option that can be used as a trigger. Again, nice, it's subcutaneous, it's pre-filled, kind of like your Gonoloft, even less work actually than the Gonoloft. So usually this is one that, patients don't mind doing too much. It's just kind of giving over that initial, kind of nervousness of doing an injection. But if you've done other ones before, then this one is going to be relatively easy. Doesn't require mixing or anything like that. So do we have any questions ready at this point, Craig?
Yes, we do. So the first one coming in is, so basically, specifically because we're on a bit of an HCG kick tonight, like you mentioned, the question comes in, what is the difference between Avodro and the other forms of HCG that you were talking about earlier? Why would I use Avodro over those others?
Yeah, very good question, and it's one that I get quite often. Now, typically in the fertility world, the big thing that will determine Avodro versus one of the other HCG brands is going to be the dose. So Avodro is much less compared to some of the other brands that can be prepared in as much as like 10,000 IUs. So that's going to be one large determining factor, just because they do work the same way. So, however, I do know that there is a difference in how they're made. I believe the Avodro is made through like a recombinant DNA, so like gene splicing, super high tech above me. And then the other HCGs are made through urinary HCG, so it's actually extracted, the hormone's extracted. So they're going to do the same thing within the body. They're going to cause the same thing to happen. So like I said, typically in fertility, your dose is probably going to be the most determining factor, or maybe if you have coverage for one or the other, depending on your dose. So definitely something I would run by your clinic, but usually they're interchangeable if the dosing is the same.
Great, thank you very much. I know sometimes that can be a bit confusing because we talk about the interchangeable natures of the HCGs, under one pillar, and then we talk about Avodro separately, but, so I think sometimes for people it can be a little bit confusing. So thank you for clarifying that. Okay, so let's see this question. I enjoy when this one comes up because I like listening to the answer, but this one is about the ever-present fear over the bubble. And so this one is, will a bubble in my injection cause an issue or cause a problem for me? And how big would it actually have to be for me to start getting worried?
Yes. So this is always the common question, both on my live sessions and with patients. So this is one that, definitely a fear, because Hollywood and the movies has scared us beyond belief about air bubbles. A few things, kind of myths about air bubbles that, they can cause you to go into cardiac arrest and all this. So it would take an extremely large air bubble injected directly into the vein for that to happen. when you're doing a subcutaneous injection, you are going into that belly fat. So a little bit of air, even a decent amount of air, a quarter to half an ml is not going to hurt that tissue. It might be a little irritated afterwards, but it's not going to cause you, physical harm in terms of your life and your health, like the movies would make you think. So the Avodro does a lot of times come with a little air bubble in it. If that is the case, you can just inject it. It's going to be totally fine. Or if you really, really hate seeing that air bubble there, and I totally understand that, you can actually prime it to get it out. So depending on where the air bubble is, if it's down around the plunger, you're going to want to kind of flick with your nail to the side of the plunger until it's totally at the top. Once it is, you can gently push up on your plunger and the air will come out and you will see small little bubbles come out the top of your needle. You know at that point that you're totally primed. There's liquid going through from your plunger all the way through the needle. Now be very, very careful if you choose to prime, because if you push this too hard, you don't want to lose all of your medication at the top of your needle. So you're going to want to push nice and slow until you see just a couple of bubbles come out. If a little bit shoots out, that's all right, but you definitely don't want to push a big amount out of the plunger, otherwise you're not going to get your full dose. So don't let the movies scare you. The small little bubbles that come in these syringes aren't going to hurt anything. A lot of times that's even just displaced through the needle as the rest of the liquid's going in. The air is the last thing to come out. So a lot of times it doesn't even reach your skin. So very good question though. It's a common one.
Great advice. Don't let the movies scare you. So I like that. That's kind of just our bumper sticker now. That's what PharmAssist is for. Do not get your medical advice from your Hollywood movies or your daytime TV. Those are like the two places that are not good enough places to rely on. So thank you so much, Kaitlyn, for putting that to bed so that people can feel more confident. All right, so let's see. Let's move on to the next question. It says, can you provide some tips on how to store my Avodro?
Yes. So just kind of a general rule of thumb, when you get your box of medications in the mail, some of it is going to be in a cooler kind of temperature controlled type bag, and then the rest will just be within the box. Anything in that bag, put it right into the refrigerator. Don't look back. Don't overthink it. Put it right in there. That's where it needs to be. And the Avodro is going to be included. So put that in the refrigerator. As long as it's kept nice and cool, then it's good until its expiration date. Very similar to Gonoloft. So just put it right in there. Anything that is not in that bag, you can keep out. Now, I have had some patients mistake kind of that cooler bag for some reason it made them think I need to put it in the freezer. So I have had patients that have put their meds in the freezer and they did freeze. I believe the official recommendation is that is to get on new medication. So we definitely don't want that to happen. So anything in that bag, put it right in the freezer. I also tell my patients don't put it super far in the back. If you have, at the tops of a lot of refrigerators, things will freeze where the cool is coming out. So be careful of that, just be mindful, but just put it right in the refrigerator and you'll be sure it's being stored appropriately until its expiration date.
Perfect. And just to clarify, because there was one time in the middle, you said just put it right into the freezer, and then
refrigerator.
Came back and put refrigerator. So yeah, so I just want to make sure that we had it on record. But yes, one of the great things actually at Mandel's, we do provide, when you open it up, we kind of want you to treat it the same way you do like your Amazon shipment that comes, and nobody just kind of shoves it off to the side and says, oh, I'll get to you later. Like there's a reason why you ordered that, because you want it. The same thing, treat your medication the same way. When it shows up, open that box up right away, and we actually do have information right in there. You can compare, your list against what you have in there to make sure that you're not missing anything, but more importantly, to Kaitlyn's standpoint, that you're not accidentally something at the bottom of the box that you don't notice and you throw it away or something like that. You can go through and see how everything needs to be stored, and it really is an easy way to make sure that you get everything in the right place and you're ready to go for that injection. So definitely don't wait until right before you're about to give that shot, because that's not the time you want to be having to go through everything when you're about to get ready. You should not have left the box just sitting around. That would be a bad situation, right? So we want to make sure you go through it and store everything, but we do provide that information to make that a lot easier for you. So Awesome. Thank you so much, Kaitlyn.
Mhm.
Let's see. Okay, so this question coming in is similar to the question we asked before, just kind of about the mechanism of action. And it just comes in saying, how does Avodro actually work in the body? What is the point? I know you've covered this a couple of times, but just because obviously the question was asked again, I just want to make sure that we are clear and that everyone feels comfortable with, Avodro versus HCG and the similarities there.
Yeah, absolutely. So, again, Avodro is a form of HCG, and so it's going to cause ovulation. So, the actual structure of HCG is similar to LH hormone. So, in a natural menstrual cycle, your LH surges, and that's what causes ovulation. So, here we're just mimicking that by using HCG. When this happens, it kind of tricks the brain, says, hey, I have an LH surge, let's ovulate. So it's kind of just a way for us to control when that ovulation happens. So again, that's why it's so important with the timing of this medication, whether you're doing an egg retrieval or a lot of times Avodro is used for IUI cycles or timed intercourse. So all super important with the timing for this one because we are causing that ovulation to happen, which is the basis of most cycles. So very good question though.
Perfect. Thank you. Yeah, I know sometimes, just like you probably hear all the time or deal with every day with your patients, that, a lot of times you share information and sometimes it feels like it just kind of washes over people. And it's a lot. There's a lot going on. And during your appointment, during PharmAssist, there's a lot of information to retain. And so one of the key reasons why Kristen, Kaitlyn, you mentioned this at the very beginning, that the idea of these programs, hey, yes, you can watch them live, and we love, that you share and ask questions live, but also know you don't have to sit there and take all those notes. You can go back and go and say, like, what was that part about the storage, or what was that thing about the mechanism of action, or whatever it might be. That's why we keep these on demand, so that you can go back in and take a look and see, okay, here's how this medication is working. Here's why it's so important to take this one at the time that they told me versus this one I have a little bit more leeway, whatever it might be. And sometimes you might just want to watch it 5 seconds before that shot and say, okay, like, say somebody is going to help you with the shot. Now it's your turn to sit down and watch the video. You don't have to watch the whole hour thing, but you just watch the 3 to 5 minute clip of how to walk through the product, and that could be enough to get you through it. So thank you so much for covering that question again, just to make sure that anybody at home, has the answer they need to feel comfortable. And with that being said, I'm checking around and I think we are all good with questions. So as before, we will get ready to start wrapping it up. But if you want, we'll throw it back over to you, give another like 30 seconds in case people have questions again about anything. It doesn't just have to be about, Avodro, or you can kind of talk about any of the 3 products, HCG, Gonoloft as well, bring them all together. And then if not, we'll get ready to start wrapping it up.
Perfect. Perfect. So, just as Craig had mentioned, I usually recommend to my patients that, of course, before your meds are ordered and you're curious about these injections, always a good idea to watch the videos at your own pace. I don't want you to get overwhelmed, but I also want you to know that you have resources. So, if that's something that you want to do before you get your medications, great, you're one step ahead. I do request that at least when my patients get their medications, to look at what's in their box and go ahead and watch the videos on what's in there. That way, if there's, any questions ahead of time, we can tackle those and make sure you're completely comfortable if there's anything that the videos don't cover. And then along with that, I also recommend how Craig had mentioned, a lot of times in an IVF cycle, you're starting out with 1 or 2 medications. So on that first day, go ahead and watch those short clips right before you're about to do those medications. And then sometimes an additional medications added in partway through. So when that time comes, rewatch the video again, make sure it's nice and fresh in your mind. And then same thing when you get to your trigger injection, watching that right before you do it. I think that it really helps to make you feel confident, and it's nice and fresh in your mind, so you don't have to struggle to think back and worry about, are you doing this right? Are you mixing that right? So I think that just knowing that, the tutorials that we're showing are on the main page, and they're nice and short. So it's not going to take up a lot of your time, but it's going to be a nice little reminder right before you do it. And then for additional info, just pull up these lives and we have some small tidbits and tips in there. So Any other questions rolled in, Craig?
I think we are all good. So I think you did an excellent job, and you apparently answered all the questions that anyone could have asked. So great job. So we can start wrapping it up now.
Awesome. So thank you all so much for joining tonight. I hope that these videos do make you feel more comfortable, put you at ease with your injections. Just another reminder, all of these are included, the pre-recorded videos, the live stream, all of that is going to be available to you at mymandelsPharmacy.com/pharmacist. So you can refer to them whenever you would like. Again, thank you all so much. Thank you, Craig, for having me. I'm going to throw it back to you to close it out.
Awesome. Well, thank you so much, Kaitlyn, for joining us and for all your time and your expertise and answering questions and offering your own little tidbits of knowledge that you gained, obviously knowing some of the questions that are unasked. And those are some of the best ones to be able to answer, because sometimes people don't even know exactly what they want to ask. And so you're able to bring that. So thank you so much. We really, really appreciate it. And obviously, I want to thank everyone at home who joined us via Zoom or Facebook Live for sharing all of your excellent questions. We hope that you were able to learn something tonight, because that's really what makes the PharmAssist program so great, is the interaction with you. And they tell me that repetition leads to retention. So I will say it one more time. I know you just said it, Kaitlyn, but do not forget that all the full virtual learning experience videos, or VLEs as we call them, as well as those individual product demonstration videos, are available for you to watch on demand at all of our locations. So our YouTube page, our Facebook page, and obviously on mymandelsPharmacy.com/pharmacist. It's a great place to be able to pick and choose, and everything is broken down, like you mentioned. So you can find the full videos, or you can watch just the little bite-sized clips as well. And there's some other information there that you might find interesting. Some of our behind the shots videos talking about some of the reasons why people got into RE and IVF in general. And so there's some really great information there to support you on your journey throughout your own personal fertility journey. So we definitely want to say that we look forward to seeing you all here again next Monday night at 7 p.m. Eastern Standard Time for another excellent program. And the most important thing we can say is to share, share, share. If you found anything in this that was valuable to you, please let a family member or a friend or a colleague or anything that somebody you bump up against in Target. Well, maybe that'd be a little bit too intrusive, but all the other groups are fair game to share with them. If you think they can benefit from this program, let them know, because that's the best way to find out about this program itself, but also to help people that you come in contact with to find out about what's going on and to be able to ask those questions that they may feel uncomfortable asking their family and friends. So anyway, with all that being said, thank you so much. Thank you again, Kaitlyn. Thank you, everybody at home. We hope you had an excellent time. We look forward to seeing you again next week, and we want to wish you a great night. Have a good one, Kaitlyn. Thanks again. Bye, everybody.